everybody and welcome to my channel. Today I want to share with you a little bit about self-breast examinations since it is the month of October and we as women have been aware of breast health, breast care, self-care and mammograms. So as you all know, it's important to go for a mammogram, and the reason why it is important is because it will pick up early breast cancer that you won't be able to feel with your by examining your breasts. So yearly, between the ages of 40 to 55, you can go for a mammogram, but in between that year, at least once a month, you should be doing a self-breast examination. For women who are postmenopausal, you can choose a day in a month and do your examination. If you are still somebody with a period, then you would wait 7 to 10 days after your period before you do your breast examination. Now, when we do it, we need to use these 3 fingers, and we are going to use the pads of our fingers when we examine our breasts. You will have to do it in a lying position as well as in a standing position to make 100% sure that you've covered all the areas. Now, very importantly, you will put one hand behind your head, and with these pads of the 3 middle fingers, you will start in a circular motion, starting at the nipple, going in a circular motion around the whole breast. And obviously you'll do both breasts. Circular motion, then you would go in a horizontal movement across, feeling if you pick up anything, and maybe even add some lotion, which will make it just easier for the pads of the fingers to glide over your breasts. Thirdly, you will go in a wedge motion towards the nipple and away from the nipple, like cake slices, just to make sure that you cover all the areas in all directions, and not skip anything. After you've done each breast, one would move over to your lymph glands, and softly but firm you will work around your neck and above and below your clavicle to feel if there's any lumps and knots. Then one would move over to under the armpit, because that's where you have a collection of lymph nodes. So you need to make sure that you gently but firmly press and feel if you find anything abnormal. And then again, here's your breastbone. You would work on both sides of the breastbone and firmly work your way up and down to feel if there's anything that's just not the way you know it. This you will do standing, and you will do it lying down. Now, what are we looking for? We are looking and feeling if we can feel bumps and lumps and knots. The other thing we're looking at is when you look at your nipples, you want to make sure there's no nipple discharge, okay? And then, do you have any breast pain or any nipple pain? That should also spark a concern for you to go and see your doctor. The other one that you have to look out for is your nipple, whether it's inverting or retracting, meaning that it's pulling in. That is also not a normal scenario in breasts. Then we're also going to look at changes in the skin texture. So if you see any changes in skin, have it checked out. Then obviously you will feel for the lymph nodes to feel if there's been any change, because we all have lymph nodes, and depending on if you're ill or not, they might be swollen. Then we will also look at dimpling. Now, dimpling is like an orange peel look on your skin of your breasts. So as soon as you see that, also see your doctor. And then any form of redness should also be alerted to your doctor, and any swelling. So those 9 things are what you have to look out for when you are doing your breast examinations. Remember, a yearly mammogram is there to detect breast cancer that you can't feel yet, and your self-breast examinations need to happen throughout the year, every month, because remember, cancer can pop up in between your mammograms, and therefore it's important to be able to do your self-care. Remember, you as a woman owe it to yourself. It's your health to look after your breasts, because at the end of the day, when you put yourself first, you can be the best version of you and your family.